Thanks to Claire and the committee for inviting me to speak. As I listened to the presentations and listened to Mark Twain's quote, I thought of that really I have a son who's 24, and actually he's taught me more about young adulthood than I think perhaps I've taught him about adulthood. So maybe we should have a different quote. This morning I'm given 15 minutes to talk about access and utilization of healthcare by young adults, and it reminds me a bit about having a 21-year-old come into your office and basically no background history, no knowledge of what his or her insurance covers, only has 10 minutes at most, has an acute problem, doesn't want to come back to see you, and doesn't want a word told to his parents about what the issues are, and then his mother calls you 15 minutes later and wants to know what the problem was. So if you think taking care of adolescents is hard, young adults present a whole new challenge. And what I hope to do today is give you a brief oversight into some of the issues of access and utilization. So in my presentation, I'm going to talk about why do young adults need health care services, how do they use these services, how much does it cost them, what don't they get, what are the systems that serve young adults, and how we might make things better. So why do young adults need healthcare services? The major problems of early adulthood are largely preventable. Many of these problems are linked to behaviors and conditions with related outcomes. Few young adults have serious impairment that interferes with daily function, but those with chronic conditions, including mental health disorders, must learn to manage these conditions with increasing interdependence. This slide outlines a review done by Gore et al. In The Lancet last year. It looked at the global burden of disease in young people aged 10 to 24. And I think what it does is really highlights the issues of young adults in particular. If you look at that 20 to 24-year-old category, if you ask most people what young people are being impacted by in the world, they start, especially in low and middle income countries, they start talking about infectious disease. There are only 2 infectious diseases listed in this category now. 5 of the issues are mental health disorders, 2 are violence, and 1 is related to reproductive health. So the world is changing. They're catching up with us here in the United States. As they transition through young adulthood, they're beginning to continuously assume responsibility and learn to navigate this system. But in particular, where we have kind of developmentally based healthcare systems for adolescents, we really don't have that system, and maybe that type of system may be more beneficial for this group. I've put kind of healthcare services into 3 areas. 1, preventative services, 2, sexual health services, and then care for chronic conditions. In the preventive services area, we have kind of 5 areas that need to be addressed. The sexual health services, we have 3 areas, and the care for chronic conditions, which places an increasing burden on the system that you have to learn how to manage these mental health issues in primary care settings, and those conditions that occur prior to or with peak onset during early adulthood. For preventative services for young adults, we really don't have guidelines for young adults that are developmentally based. Bright Futures, which is kind of the Bible for most pediatricians in terms of how to manage prevention during early childhood and adolescence, they have some specific recommendations for 18 to 21-year-old. And then when you reach young adulthood, there are certain professional guidelines that are generally specific to diseases and conditions that are really built around adult issues. However, we did an analysis that co-authored by a couple of people in the audience. Ozer is the lead author, and published in the Archives of Diseases of Children and Adolescents last year. The interesting thing, this article they wouldn't accept it in the Annals of Internal Medicine, which I found interesting because that's the group that should be looking at this. But we found that there were 6 really evidence-based guidelines, I think Larry maybe spoke to this yesterday, that were directed towards young adults and could be the basis for preventative services. There are certain consensus statements around safety and illicit drug use. So let's move on to chronic conditions. If you have a chronic condition, how much limitation does it place upon your daily life? In the National Health Interview Survey, young adults, young women reported about 15% of them had limitations in their daily functioning, whereas males reported about 12%. If we look at the prevalence of chronic conditions, the two big players here are asthma and obesity now. Hypertension and heart condition are somewhat important too, but then the rest don't play a major role here. If you look at the National Survey on Drug Use and Health from 2010 and look at past year mental health and substance use disorders, these are reported by young adults, and you see a kind of interesting perspective on how gender plays out here. Because if you look at the your left-hand side, you see that young adults, females, have much higher rates, at least report higher rates of serious psychological and depressive disorders, where males report much higher rates of alcohol and drug abuse dependence. And then if we look at the transitions from pediatric to young adult care, there are reasonably good guidelines developed by the professional organizations. But if we look at how many young people are prepared for this transition, only 39% report. Actually, these are families that report that their children at ages 15 to 17 receive the necessary services to transition to adult health care, work, and independence. So how do young adults use healthcare services? There are a whole range of health services that they use, ranging from office-based visits to dental visits. But look at this, no usual source of care. A third of males report that they don't have a usual source of care, and a fifth of females report they don't. And if you look at adolescents, they do reasonably well in this area. If you look at whether they come into services, if they do have access, females use services about 2.3 times a year, males about 1.1. This range is 20 to 29, a little bit different than the age group we're talking about here. But then if we look at what do they come in for, mainly acute and chronic care, very few access around preventative care, with, again, females really coming in more often than males. So what about overall healthcare utilization by this age group? If you compare them to all other age groups, with a referent group here being young adults, only 72% of them have any utilization, and that could be going into a drugstore. If we look at office-based utilization, only half of them make it in. If we look at ER, they're great users of the ER. They're the second highest group and they compare equally well to very early childhood and the aged. So if we summarize this, young adults receive care from a variety of sources. Many young adults lack a usual source of care. Females generally use care more than males, and young adults have the lowest utilization rates for most services, but especially high use of ER. So how much does it cost them? So this slide looks at young adults' cost. They spend about $2,000 a year on cost. But I think what's interesting in terms of out-of-pocket costs, about 17% of their costs of out-of-pocket. Now they look similar to adults and adolescents. However, a large portion of their costs probably place really significant challenges on them in terms of the system, because many of them don't have financial assistance from family members. So what don't they get? This slide highlights a study done by the Commonwealth Fund looking at young adults experiencing what they experience over the past year. The white are young people that are insured all year. The yellow look at insured now, but at some time not insured in the past year. So this is partial insurance. And the third, the orange, really is uninsured now. So what it looks like, if you just see the slope of the curves, it all gets worse if you don't have insurance. So did not fill a prescription is the first one, skipped recommended test, treatment, or follow-up, had a medical problem, did not visit doctor or clinic. Half of the ones that were uninsured had a problem, never showed up, did not get needed specialist care. And then if we look at the unmet needs around mental health services, so remember that drug abuse and alcohol dependence were more common in males, but yet only still around between 10 and 7% of these males get in for services. But if you look at major depressive disorders, it appears that females get in do better than males, but even those, only half of them get in for care, or less than half for serious psychological. So if we look at preventative services, so what happens in this area of preventative services? This is a study that from the National Health Interviews Survey, and it speaks to some of when one of the attendants raised her hand and sort of stood up at the microphone and said, actually, there are a lot of data sets which are available that you can find out about what's happening. And NHS maps a number of the national data sets that look at utilization, access to care, provide us with a framework. You can really look at what's happening in young adulthood. So, for example, this is an 18-25-year-old analysis, and blood pressure checks got done highly, but that's probably because they weren't done by doctors or nurses. They were probably done by individuals who are staff support that are instructed that that's what they do when a young person walks in. But look at this. In terms of talked about smoking, if you're a smoker, actually 50% of females were talked about, and a third of males were. And we know there are really good interventions that can help individuals with smoking. Only a quarter of females got a flu shot, and about 10% of boys got a flu shot. This slide kind of confirms what I just said recently, that what happens when you get in for care, what kind of preventative counseling takes place. Well, in all specialties, about 30% got something. Primary care, about 32%. OBGYN got 33%. But what I want to highlight here is the issue just to look at OBGYN. Look at this. Go down to STD and HIV. Only 7% of young women that were seen by an OBGYN got talked about regarding STD and HIV. It seems to me that's kind of basic if you go to see an OBGYN physician. So insurance matters, and Abigail English will talk with us more about that. The unmet needs are high, especially in regard to mental health, and the receipt and content of preventative services is really very low. So what are the systems that serve young adults? So this is the only slide that I could think about a system that serves young adults, because there basically is no system of care that serves young adults, which actually I was supposed to address that. So what I thought I'd just highlight is the differences between adolescents and young adults. With adolescents, there's a defined provider. With young adults, there is no identified provider. With adolescents, there's a financial system in place, and it's been in place for many years now with good coverage through Medicaid and other service systems. There's no financial place. There's one that might be emerging. The organizational structure for care exists. There's no identified organizational structure in this age group. Adolescents are always claimed to be high users of non-traditional sources, but they generally use traditional sources of care. The young adults have always been high users of non-traditional sources of care. Whether that's because they don't have access in other systems, we're not really certain, but they're high users. And minors, really under age 18, parents play a major role in accessing systems, bringing them in, dragging them in, etc. But once you hit 18, the systems all change. The financing system is really difficult to manage, and many of them are left out. And this system enables really acute care management over preventative and chronic disease management. So this abrupt change at 18, which has been spoken about for the last 2 days, the healthcare system is similarly the change in legal status. They can legally consent to their own care. They lose eligibility for public insurance, which may be changing with ACA. And there's very limited models for transition to adult care. The youth with special health care needs is one important exception where there are guidelines, but even with guidelines, not much is done. And then there's little preparation for change in this system. Young adults and families don't seem to have a way to navigate this system and don't know how to deal with it. And then we don't know much about what young adults want. I tried to search and try to find this out. There's lots of information about what adolescents expect from their clinicians, what adolescents want when they come in to see someone really isn't present. And then young adulthood is characterized, which part of this conference is dealing with, is varied trajectories, settings, levels of parental involvement and support. And it's much different than adolescence. So it's challenging to try to figure out these different settings, situations, and then there are populations which are also being discussed: military, prison, college health. So populations include youth who are homeless, foster care, justice system, and then chronic conditions. And then the mental health care system, to me, is a nightmare because, in a sense, there's carve-outs, they're both public and private insurance. There's a whole separate mental health system that is not integrated with the physical healthcare system, and yet primary and secondary kind of specialists are supposed to care for these problems. There's poor coverage of mental health services in most private plans with capping and high copays. So just to speak to some of the positive things, I think. In 2012, about 2/3 of primary care physicians reported use of the EMR. I think this is a real opportunity to improve our communication with young adults. Young adults are readily kind of knowledgeable how to use this kind of social media. And as you can see here, in 2010, 60% of young adults said that they had visited social networking system daily, and relatively the same number had sent and received a recent email. I will tell you, my own son negotiates with his clinician online, sends him pictures of his rashes, etc. I wouldn't dare do any of that, and he seems to feel totally comfortable in doing that. So systemic issues, summary: there's no organized system. Young adults have traditionally had the lowest rates of insurance, poor, near poor affected. But even if we fix that, you got to build a system. This focus on acute care, the system is not developmentally based, and EMR and social media are opportunities. So how do we make things better? These are some next steps that I kind of thought we should address. Understanding what young adults want and their decision-making related to health care. Advocating for the adoption of a development-based services and systems for young adults. We'll have to build it because it's not there yet. Clinical training is not directed towards anyone learning anything about this particular age group. We need to improve the services for vulnerable youth, especially in those with mental health and substance use disorders. Need to figure out how to smooth these transitions. And I think the use of electronic and social media to enhance delivery system, health promotion and prevention is a real opportunity. Thank you so much.
Thanks, Charlie. And I want to encourage people who are listening today on the web as well as in the audience to note some questions that you might want to ask after our next speaker. So now I'd like to invite Abigail English, who's the director of the Center on Adolescent Health and the Law. She will be speaking about the ACA, and I would say she's America's adolescent health lawyer with her commitment and dedication to this age group. You can imagine the thousands and thousands of pages in the Accountable Care Act, and we're giving Abigail just 15 minutes to do some highlights on what is the promise of the ACA for young adults and what are the challenges in implementing the law so that these kinds of opportunities and expectations can really be fulfilled.